relaxing in Portugal have been rushing to get home. Last week, if you remember, the UK removed Portugal from its travel green list after coronavirus variants had been detected there. Now, anyone returning to the UK from Portugal has to undergo quarantine. Portugal has blasted the decision as lacking logic. A new study found that travel restrictions last year did not stop a new variant from taking over Europe and spreading across the world. I'd like to bring in Dr. Ricardo Baptista Leite. He is a member of the Portuguese National Parliament and head of the public health at the Catholic University of Portugal. Ricardo, thank you very much for being with us this hour. Let me first get your reaction to the government's decision to move Portugal to amber.
Well, thank you so much for having me. It is quite unbelievable that the UK has made this decision 3 weeks after they decided to put us on a green list to allow football fans basically to come see a football match between two English soccer teams in the city of Porto. 3 weeks later, when the COVID scenario in Portugal did not transform itself tremendously, we see a reverse in that decision-making process, which makes us think that it is not based on science, but based on their own economic, personal interests. And the truth is, if we see the way that those football fans behaved, some of them almost as hooligans, in comparison to those that we were welcoming now, families, middle-class British families, elderly people from the UK who wanted just to spend a week or two in the Algarve, which, by the way, is one of the safest places in Portugal right now when we look in terms of COVID numbers. Well, it is quite astonishing how the UK is making these decisions with a tremendous negative impact. And you can only imagine in terms of the tourism staff, hotel staff, restaurant owners, everybody is in despair because we worked so hard to welcome the British citizens as tourists here, not to speak about the Portuguese citizens living in the UK wanting to come to Portugal, and also business entrepreneurs from Portugal going to the UK. So this is really disrupting and certainly not based on science. And policy at this point should be based on science. Instead of going back and forth in terms of these amber and green lists, what we should be discussing is how, in this new time with vaccination, can we find solutions to make sure that we keep travel corridors open.
Doctor, it's clear that you're angry about this decision and frustrated about this decision. We heard from the UK government basically saying that they saw a rise in COVID cases in Portugal. That was the reason for their decision. They spoke of an Nepal variant. What's your response to this?
Well, listen, if we look at the data, even in looking at WHO data, we see that there is really no significant scientific knowledge to consubstantiate a decision to reverse our position, especially because the number of cases of the Indian variant, not to speak of sub-variant as the Nepalese variant, we see here in Portugal are minimum, especially when in comparison with the UK. And so it's quite astonishing, especially now that we have seen that in terms of vaccination, it is highly effective, including against these variants. We haven't seen a rise in terms of hospital bed requirements, in terms of ICU, and certainly not in terms of deaths. And so at this point, we cannot keep using the formula from 2020 to respond to this challenge in 2021 when we have a greater knowledge of how to deal with this virus. We have a greater knowledge of the impact that vaccination, which is becoming widespread, has. And so honestly, I think that the lack of a true global health convention is undermining our economic efforts to get on our feet. And these kind of solutions are bad, not just for the Portuguese economy, but for the global economy, including the UK. And so looking at the countries not as a whole, but looking at a regional approach, discussing a vaccination certification, finding solutions that can keep citizens safe, both tourists and people living here, is the way to move forward. And that is exactly the opposite that the Prime Minister Boris Johnson and his team have been dealing with. And we just heard today that Boris Johnson has asked his citizens to take their holidays across the UK. So if there was a real concern about the variants, which are quite present in the UK, he would be basically disseminating within the United Kingdom, which is exactly the opposite that a public health approach would need. So there's a feeling, once again, that there are other interests that are not based on science focusing the UK's decision-making process.
Okay, so other interests not based on logic, not based on science, Dr. Leite. You said that the Prime Minister here, Boris Johnson, is asking for families to stay in the UK, holiday in the UK. As they prepare, though, as some of them prepare for their summer holidays, what is your message to Brits who want to come over to Portugal if this is not based on science, if this is based on politics, let's say?
Well, I'd like to say to the British people that Portugal is continuing to work hard. Our hotel owners, our restaurant owners, our taxi drivers, our Uber drivers, everyone on the ground has been working around the clock to make our country safe, to welcome everyone who wants to visit us. We ask them, those that come, to comply with the rules as the Portuguese are complying, and together we can get out of this stronger. I would actually like to reinforce the invitation of the president of the Madeira Islands, who actually invited Prime Minister Boris Johnson to come to our country and spend his honeymoon among our citizens, and to see how safe it is. I'm sure that we should all be focusing more on finding solutions on how to overcome this pandemic than just focusing on a nationalistic approach, which will at the end undermine us all.
Yeah, I mean, I don't know if you heard me earlier, just before I came to you, saying we found that the researchers have found that the mild travel restrictions, such as recommendations to quarantine after international journeys, Doctor, failed to stop a new variant of coronavirus from taking over Europe and spreading, which begs the question, like you said, about the whole system there is in place right now.
Absolutely. That is the main question here. You know, if we were to manage air traffic control the way we are managing global health, we would have a plane crash every 5 minutes. There is no kind of rules and regulations that actually support countries in a coordinated manner to make sure that we are responding adequately in the face of this pandemic. And of course, this is all new, but 15 months have passed. We need a multilateral approach. We need a global public convention in which those rules and regulations are settled so that we can keep citizens moving, but in a safe manner, which is exactly the opposite of these kind of approaches where each country is doing whatever they feel they should do or whatever their local constituents are asking them to do. We need to make decision-making processes that are based on science and coordinated at a multilateral level. Sadly, as you mentioned, these kind of approaches do not have the impact of stopping the virus, which should be our main concern at the same time as we try to make sure our economy kicks back and that we overcome this pandemic.
Well, I hope Prime Minister Boris Johnson is watching. I hope he gets your invite to honeymoon in Portugal, anywhere in Portugal in the Algarve, where numbers are very low, like you said, Dr. Leite. I, for one, am very looking forward. I haven't seen my family for over a year and a half who live in Lisbon. I'm very excited to see them. Thank you very much, Dr. Ricardo Baptista Leite, joining us from beautiful Sintra. Thank you.